Hi, I'm Betty Long, and welcome to the Lighting Your Way podcast. During Season 2, we are delving in deeper to the amazing lives and stories of nurses and other healthcare professionals from around the country. We will also be talking with a few of my nurse advocate colleagues at Guardian Nurses, and on occasion, even some real live patients. You'll get a behind-the-scenes peek at the healthcare system, as well as get advice on how to get the best care when you or a loved one is a patient. Hi, I thought that as we approach the Christian holiday of Christmas, which celebrates the birth of Jesus, that it might be fun to talk with a nurse who works in a very busy labor and delivery unit in Philadelphia. Joining us on this episode is Alicia Valentine, RN, MSN, RNC-OB, which means she has a certification as an obstetrics nurse. Alicia has been a staff nurse for more than 38 years, 27 of which have been dedicated to supporting moms and safely bringing babies into the world on the labor and delivery unit. She is a certified childbirth educator, certified interpreter for Spanish-speaking patients, and an adjunct clinical OB instructor for both LaSalle University and Gwinnett University. I hope you enjoyed listening to Alicia as much as I enjoyed talking with her. I am so happy to have you as a guest, Alicia. You and I met this past fall when you were nominated as a finalist in the clinical nursing category for the Nightingale Awards of Pennsylvania. And in my role as a board member on that organization, I was charged with writing and recording your profile for the awards gala. And while I typically get every finalist's resume and written statement, I always like to call a nurse so that I can get to know them outside of their resume. And honestly, when you and I connected on the phone, it felt like I was talking to an old friend. And we grew up around the same time in the same neighborhood, and we almost worked together at the hospital that you're at now. So I so enjoyed, our conversation. I wanted to do it again. So I asked you to be on the podcast. So welcome, Alicia Valentine.
Thank you, Betty. Thank you for inviting me to be on your podcast. And I just want to say that it was an honor to be a Nightingale finalist. I'm so very honored, and that is going to be a highlight of my life, one of my highlights of my life, being
wonderful.
A finalist.
That's great. Great. I'm so sorry it was a virtual gala this year. I'm so sorry I didn't get to have you come to the soiree, next year maybe.
Maybe next year. But we do, as healthcare, we need to be vigilant and also let people know this is the right thing. This was the right thing to do.
Right.
With COVID.
Right.
So
no, absolutely. Thank you.
Yeah, I missed it, but I understand.
Yeah, it was a really hard decision to make, but I think we made the right decision. But, hopefully in 2022, we can have the in-person gala, and you can come then and bring your fans. Yeah. All right. So let me start to ask you to tell your story about how you became a nurse. I remember when we talked in the fall that, your mom had a big role to play in that decision. So tell us about how you got started.
Well, when I graduated from high school, which I went to an all-girls school called Little Flower, my mother, she encouraged me to be a nurse. And I was still not quite convinced that I should go that route. So what I did, I went to Temple University for 2 years, and I felt lost. And I was like, I should have listened to my mom. And so,
of course, you didn't tell her that then.
No. And, well, I think I did. And then she was, see, I told you. And I applied actually to Einstein School of Nursing, which they had a School of Nursing in 1981. And I graduated there with a diploma in nursing. And through the years, I always wanted to teach. I always felt like, there were nurses that came under me. I always wanted to take them under my wing, and I would teach them what I knew. But with raising a family, getting married, and having 2 children, and then I worked nights, it was difficult for me to, it was in my thoughts. I want to go back to school. but it was difficult to get there.
Sure. Yeah.
And the institution that I worked at that moment, they said to me, you know, my nurse manager would say, yeah, we want you to go to school, but you have to work these hours. There's no, like, you have to manage school around your work hours. And I was like, it's going to be impossible to do. But, well, God, you know, God has a way, and they closed that hospital after I worked there 20 years.
Wow.
And so I started looking for where to go, and I got hired by my present institution. And because I was very lucky, because the doctors that were at my former institution got hired at my present institution.
Oh.
And they said, and they said to the administrators there, you need to have some day positions for our nurses that are coming from the previous institution. So I was very fortunate to be offered a day position right away starting. And I took it.
Oh, that's great.
Yeah, I was getting paid actually less than what I got paid at my former institution, but I didn't even care. I was like, nope, I'm taking this day position, and I'm going to start.
Right. You got days.
Here. And I got days. And I have to say that the present institution that I work at, they kept saying, you know, you go back to school, we have tuition reimbursements and this and that. And the nurse manager that I had at that time worked with the nurses. If there was a class that I had to take on a Saturday, and she said to me, every Saturday, and I said, we had to work every third week. And she's like, if you find somebody to work for you, it's not an issue. If you can't find somebody, well, I'll work with you. And she did.
Great.
And that's how I was able to get my BSN first.
Oh, that's
from
great.
Ohio University online. My a coworker said, come on, let's do it together. And I was like, okay. And in 2014, I got my BSN after I graduated from nursing school in 1983.
It doesn't matter. That's great.
Matter.
That is great.
No.
Wow.
So, and I said life, you know, and God has a road for me. And later in the years, my husband became very sick and ill. And when in 2014 I graduated with my BSN, he was one of the first people that said to me, you need to keep going and get your master's degree. And
oh, brother.
Like, no. Yeah, and
Jeez.
I was like, no, I just got done this. Let me just kind of savor it for a moment, you know.
Yeah.
But I think it was, you know, it was God's plan, because I don't think I could have done it, because then he started to get sick and sicker and sicker. And in 2016, December of 2016, he passed away.
Oh, I'm sorry.
And my coworker that encouraged me to get my BSN, 3 months later after my husband passed, I went back to work, and she's like, come on, let's go into this master's program. And I was like, no, I can't even think about anything. Like, my husband of 35 years just passed. I'm distraught. She's like, you can do this. Just call this guy. He's a recruiter at the university. Well, needless to say, by the time I was done our conversation, I was enrolled.
Oh, yikes. That was quick.
Yes, in the master's program.
You didn't even know what hit you, right? Jeez.
I didn't even know. But that was God's plan, because I was so busy writing papers and studying that I had no time to really be sad or depressed. And in 2018, I graduated with a master's degree in nursing education from Grand Canyon University.
That's great.
So
you've come full circle, kind of, right? You wanted to go into education back in 19. Wow. So
83.
you're a RN, BSN, MSN. Yeah.
Emerson, yes.
Yep. And so all this years of nursing, how did you find yourself in the labor and delivery unit? Does it have anything to do with the
Well,
education that you do for moms, or?
no, I kind of fell into it because what happened is with the schedule that I had with my children and school, I went per diem. I did med surg and telemetry for 13 years. And then
Okay.
it wasn't working, that rigid schedule every other weekend and certain days with the children, it wasn't working out. So I went per diem in the hospital so I could make my own schedule.
Okay.
And what occurred was they were very short in the postpartum unit, so they would send me there. I could not work in the labor and delivery unit because of I had no training in that expertise, but I could, they taught me how to do fundal checks and, reacquainted me because we all learned that in nursing school, but they reacquainted
Sure.
me with that and what
Sure.
is normal bleeding and what wasn't. And so they would pull me there, and then the nurses there were like, you need to come and work full time here. And I was like, no, it's too scary here. You got 2 patients with each
Yes.
patient,
Yes.
but.
And they're screaming at you,
And yeah. But I needed a full time position again. I needed vacation and sick. So I kind of like with my dragging my heels in the ground, I went.
Okay.
And it was the best thing I ever did because now I am certified in childbirth education. I have my NCC certification in inpatient obstetrics. I teach for 2 universities as an adjunct faculty in OB, and I love OB. So I've been about 27 years just doing OB.
That is so 27 years of delivering or helping deliver babies. Do you keep count on how many babies you've helped bring into the world?
No, I should have, but no, I don't. Because many.
Yeah, whenever you go in, when you go into the OB unit, and there's always all the photos on the wall. I think there's probably thousands more, but I guess they're the ones that send you photos.
Yes. Our unit says they deliver about 250 babies a month.
Oh my God.
And we have 8 rooms.
Wow. So that is jumping, right? Because it's not like you just come in and deliver a baby and leave, right? You're there sometimes laboring for hours, days, maybe.
Yes. Now, a number of years ago, I will say about 6-7 years ago, it could be up to 5 days. And now, I guess evidence-based practice has shown that that's not good. So now it's 3 days. So a patient could be there up to 3 days trying to have a baby. So I always tell them, you're going to have a baby one way or another by day number 3.
We're going to make sure of it.
Somehow, some way, we're going to help you try.
And like for a normal vaginal delivery, so if they're laboring 3 days and it's a normal vaginal delivery, how long do the women get to stay in the hospital to recover?
Okay, so
generally
prior to COVID, everyone stayed 48 hours, so 2 days.
48 hours from the time they gave birth.
They gave birth, yeah.
Okay, yep.
Now, after COVID, when COVID occurred, then what they did so that they didn't spend so much time in the hospital and wanted to go home, because what happened is when you have a baby, you want your whole family to come, embrace, see the baby. And when COVID occurred, no visitors.
Right.
None. Visitors.
Wait, none at all?
None.
Not even the father?
No. In the beginning, when it started to happen, we didn't know about things.
Wow.
And so not even a father.
Wow.
Then slowly, father was allowed.
Okay.
And right at present, only one person can come. Only one person. It's up to them who they choose. Sometimes they choose the father. Sometimes they choose their mother, their sister, whoever
Okay.
they think is going to be more of a support to them,
Right.
they choose. And they cannot switch up. If that person, for some reason, has to leave, then they will have no one. And we make it very clear we cannot
Wow.
switch. Yeah.
So if I come in, so I'm coming in to support a woman who's pregnant, do I have to stay that entire time? I can't leave the unit?
You can go home,
Oh.
eat, all that stuff, and come back, but only that
Only
one
me.
person.
Okay. Got it. Wow.
Only that person. Now, after the baby is born in postpartum, if the patient, in my institution, the rule is if the patient has a COVID test when they're admitted,
Okay.
and if it is negative, then after she has the baby and is postpartum, she can have 2 visitors from 9 a.m. to 9 p.m. Whatever, the father and someone else, but only 2 people in the room at the same time from 9 a.m. to 9 p.m.
And that's postpartum.
That's postpartum. And the
Okay.
patient has the choice of staying 24 hours or 48 hours. Some of them say, you know what, I really think I need a second day. I just had my baby vaginal. I'm really sore. I want to stay an extra day. They can stay an extra day.
Okay.
But that's what happened when COVID came. Then it wasn't you have to stay for 2 days. It was like you have to stay for 24 hours. You can choose to stay the second day, but you don't have to if everything's okay with you and with the baby.
Right. Have you seen? Go ahead. I'm sorry.
I was going to say C-sections, it was the same thing. Before COVID, they stayed 3 days.
Okay.
When COVID occurred, 2 days. If they think they need the third day, they're more than welcome to stay.
Okay. Yeah, I can't even imagine, the COVID. Have you seen women who had COVID give birth?
Yes.
Oh, okay.
Yes.
Wow.
Yes. And what we do is we tell them they have to wear a mask. Wash. We're very specific with them. We tell them you must wear a mask every time you're around your baby. Wash your hands before you hold the baby.
Right.
If you're going to be without a mask, your baby has to be 6 feet from you.
Wow. Okay.
If you're not wearing your mask, but if you're going to breastfeed, hold your baby, you have to wear a mask if you're COVID positive.
Yeah. I mean, you can't risk giving it to an infant.
But this is better than, I still remember, Betty, and it broke my heart when we didn't know what COVID did or was. We were still learning.
Yeah.
And we had positive COVID moms. And as soon as they delivered, we took their babies from them. And they went to a room, and then the baby went to the nursery, and we would send the baby with family. And they had to be apart those 2 weeks before she could, when she was no longer infectious, then she could, be reunited with her baby. But she didn't even get to see her. Like
wow.
She came out, she saw for a second, and the baby was taken out. So Thank God that they know more about COVID now, so we don't have to do something horrible like that.
Yeah, that would be heartbreaking to do that, to have to do that.
Was.
But, you think you're doing the right thing because we didn't know at that time.
We didn't know about COVID. Right. We didn't know much about it at all.
Yeah. So in the all the time that you've had, right? I mean, that's a long time to be delivering babies. Like when you think back, the labor and delivery unit changed, like how, talk about some of the things that have changed besides the length of stay. Cause I've talked to some of my colleagues who had C-sections back in the, late 80s, and it was, I had 5 days in, and, then I had 4 days. And then 11 years later, when she had her 4th kid, it was 3 days. Right.
3 days.
Right. So things are moving and grooving, but like what, when you think back on your career in the labor and delivery unit, what do you think about?
I since I teach, and I tell my my students, one of the things that I remember is when I started 27 years ago in labor and delivery, I would say 99% of the women would get an episiotomy. That's
Oh,
something that has really changed. And,
oh,
now in the past years, we don't do episiotomies because evidence-based practice showed that that wasn't good for the moms. And so
for
I
what
think
reason? And can you explain for our
the
listeners who may
healing,
not know what an episiotomy
yeah.
is?
So an episiotomy is when the baby's head is crowning in the perineum. The physician would take a suture scissor or a bandage scissor, and he would cut her perineum either straight down or to the side, and that would facilitate the baby's head coming out faster.
Mm. Sounds
And so
very
then
painful.
they would, repair that cut. But studies show, they did a study. I can't quote you what, I should have it, but I can't quote you. But they did a study, and then they had women where they did an episiotomy, and then they had another set of women where they just let the baby tear them, lacerate them, and then repair them. And what they found was that the women that just tore and lacerated as the baby was coming out, and that they repaired them, that they actually healed, their perineums healed better than those that had an episiotomy.
Wow.
And so now I think in one hand I can count how many women had an episiotomy just this past year.
Oh, wow.
Before 99% of the women had an episiotomy.
Wow. So, Alicia, who's who's doing these studies? Are they labor and delivery nurses? Is it OBGYNs? Like, because that sounds like
I think it was ACOG, but I'm not 100% sure.
Okay.
But they're the ones I think that did the study. I should have it because I quoted to my students, and I don't. But it just shows, like, I'm telling you, every woman that was going to have a baby, they would have the bandage scissors there ready to just cut the perineum, and have the baby's head, come out more easier. But that wasn't good for the women,
Well, and I'll tell you, it wasn't good for the ones watching, because I was in nursing school when that happened, when my rotation, and I was like, oh my God. So, it was, as a young nursing student, that was shocking. All right, so let's talk about so episiotomy. That's a good point. Let's talk about Pitocin. All right, so for our listeners who are not nurses, Pitocin is a natural hormone that causes a pregnant woman's uterus to contract. Right, so it's used to induce and strengthen labor contractions during childbirth and control bleeding. But according to a lot of moms, and many of whom I work with, the use of Pitocin can make labor feel so much more painful and intense. So has the use of Pitocin changed in your career?
No.
Oh.
Unfortunately, doctors like to use Pitocin. It is the drug of choice.
Wow.
But as I said, we have to see if the cervix is first soft and pliable, because if it's hard and thick, you could get Pitocin and we'll be there 3 days and not have a baby.
Okay.
So that's where this, like they like to use this thing called a Foley bulb.
Okay.
When they're inducing moms. And what a Foley bulb is a catheter that is inserted into the opening of the cervix. And on the tip of this catheter, it has like a little balloon, and they inflate the balloon with sterile water. And what this does is it stimulates the hormones in the cervix to soften them. Usually when this balloon comes out, when it falls out, like you tug it and it just gives and falls out, then the mom is 4 to 5 centimeters. And then, sometimes we start the Pitocin with the Foley bulb, and sometimes we don't. So, but they love Pitocin because it lets us control the interval of contractions, and it strengthens the contraction force of the uterus. And as you said, it also controls bleeding postpartum when the mom delivers.
Do they, I mean, given some of the comments that my colleagues and friends have made, the Pitocin sounds like barbaric, but do they give medication, narcotics, or any kind of pain relief when they're giving the Pitocin? Okay.
Yes, I always, and the doctors, I know at my institution, the physician says, you're in charge if you want an epidural. You don't have to have an epidural, but if you want one, you could be 1 centimeter and say, I can't take this pain. You get an epidural if that's what you want.
Okay.
There are medications that we can give intravenously, but most of them cross the placenta barrier. So that means mom gets it, the baby gets it. Now, in the beginning, if you're 2 or 3 centimeters, you're not going to have a baby for a few hours. So it's safe. And I always tell moms, we never would give you anything that wasn't safe for you or your baby. This medication is going to wear off way before the baby's even close to being born, but it'll get them comfortable for a little bit, and then maybe later they want an epidural if they want it. Now, I've had many patients that have gone through labor naturally, and we're there to support them in whatever. They want a hot pack, they want a cold pack, they want pillows, whatever. We have birthing balls at my institution.
Okay.
So all these things to help them, if they want to try and have, a natural delivery.
Okay. What about, I know it's common now, at least, thanks to Call the Midwife, but, midwives have been around for thousands of years and doulas. So they're very actively involved in a mom's pregnancy and delivery. Does your hospital have midwives delivering babies, or, do you interact with doulas? Okay. Yes. Great.
We actually, had a midwife maybe about a year ago, and now again, we have 2 of them that just actually started last month.
Okay.
So we do have midwives that deliver their babies, and we do have doulas. We allow doulas to come, with the patient. So there's a program that through centering. There's a centering program at my institution, it's called, and there's doulas. They have a number that they can call, have a doula come, and I think through something like that is good to get a doula because they do support you. And some of them are good and some of them are not good, but they do help and support the patient and and their support person too.
Well, listen, the more support you have, the better. It really, it doesn't matter whether you're having a baby or having heart surgery. The more support is better.
Better.
All right. So I have another question about C-section. So I've read that, and I don't know if this is still accurate, but 30% of births are done by C-section. So it's a pretty common procedure, but it is, as we know, major abdominal surgery. So, what do you see now in terms of, like you said, 3 days that the moms are there? Have C-sections gone down at your place? Are they going up? Or are they still pretty much 30%?
A year ago, like I said, we had the midwives, and they introduced what's called labor in motion. So we were doing the birthing balls.
Okay.
And there's these balls that are called peanut balls, and they actually look like peanuts.
Okay.
Huge peanuts. And so when we have you on your side, we have the peanut in between your legs, and that keeps the pelvis open so the baby can keep coming down. And so we're constantly moving you around. And they did a study at my institution, and we were in an article for the city of Philadelphia where our C-section rates had come down a little bit because of this, labor in motion.
Oh,
so,
okay.
So I think we started to go back up a little bit. So now we're getting the midwives. I mean, we all do these, birthing balls and peanut balls and moving and constantly moving the patient whichever way. So, but if the baby's in any kind of distress. If the mother is in any kind of distress also, then a C-section is what's going to happen. So
Okay.
I think, that's still going to happen. But for us, we were even written up in the city of Philadelphia that our C-section rate came down a teeny little bit doing this.
Great. Yeah, because I mean it's a significant surgery. I mean it's it's major abdominal surgery.
Major.
Yeah. So all right, let me switch over to your in your spare time. You're a clinical OB instructor. And a few weeks ago we had Dr. Jennifer Fry on as a guest, and she is the founding director of the nursing program at Cabrini University in Radnor. And I asked her about the curriculum that nursing students deal with these days. And I remember when probably you and I were around the same time, had my maternal child health experience in nursing school. It was clear that I would not last long in the labor and delivery unit. But in your experience now seeing students come in, like what are you seeing from the nursing students who now I understand COVID kept them out, but let's talk about, 4 years ago before COVID. Are the students, are they ready? Do you feel like they're getting the training they need?
I think they are, like, in their syllabus. I always, when I have students from whichever, I look at their syllabus and I try to coordinate certain post-conference subjects that I go over with them with their syllabus, so that if they're studying preeclampsia, okay, I'm going to have an article about that, so that it better connects, with them, what they're learning in class. I'm reinforcing it in some way and teaching them. And in clinical, I might have them have a patient that is preeclamptic, postpartum, or whatever, so that they see what they're learning in class at the bedside. Reflexes being done, Q1 hour outputs, high alert medications being co-signed by 2 RNs. I tell them, so that they see those kind of things. With labor, I try to, tell them the stages of labor and look, this is what's going on, and there's times that I've been with them and we had a shoulder dystocia, and they were like, I said, you learned this in class. Now they were like, oh, I thought they were going to pass out. It was such an obstetrical emergency, and they could see it, and they were like almost in tears, but they are learning these things. But I had a class where I did Zoom classes, and I felt so bad because to talk about how to feel a fundus and to actually feel a fundus is two different things.
Right.
And so, with my students, as soon as someone delivers, I'm like, look, feel this. This is what a fundus feels like. And it's like their little light bulbs go off. They're like, wow, and I also, in my institution, when they come to my institution, I have them go, of course, to postpartum and see baby assessments and what is entailed in teaching, post-discharge teaching, because they have to do shaken baby syndrome. They have to, car seat. They have to do hearing tests. There are so many things there. I also have the students go to NICU because I want them to see what a preterm maybe baby looks like and the hurdles that baby has to still encounter before it can go home. And even a full-term baby. We had I remember my students went to NICU, and one of the times it was meconium aspiration, and the baby was in NICU. And, they were like, oh, my God, this is really serious. And I said, it is very serious. So that they can connect. They're able to connect what they see, what they're learning in class with my clinical. And I try to do that.
But I think for you, like what you just said, like for the folks who were not able to do that or feel that fundus, or
Exactly.
that's a huge loss, and we're going to see that in the next couple of years as nurses graduate and come into the practice. I think there's nothing like what you're doing is associating the learning text with the actual practical experience, right? When I like you, we went to nursing school the first semester. We were in a patient's room. We may not have been doing much, but we were at least in the room.
We were in there. Yes.
Right.
We were.
Right. Scared to death, looking like a rookie, but we were there.
Exactly.
So several years ago, I know there was a big deal about a lot of Philadelphia hospitals closing their OB units because they weren't profitable. Sounds like with 250 births a month that you're doing okay. But did the closing of those hospitals impact the volume at your hospital?
Yes, I understood. Like, for example, when my previous institution closed, all those patients had nowhere to go. They went to my institution, and I wasn't there for this, but they have stories where they said to me, "We had stretchers in the hallway. We didn't have the room to put all these people because now they couldn't go to your institution because they were closed."
Right.
And when you see it right here in Philadelphia, which is a very large city, I think I counted only 7 institutions that have a delivery, a labor and delivery unit.
Wow.
In the city
in the whole city?
That's crazy. Most of them are downtown.
Wow.
Most of them are all down center city. And then you come and there's Temple and then Einstein, and that's it. Like, you talk of any other hospitals beyond, that's a little further out from Philly.
Right. Yeah, and there's always going to be babies being born.
There's always going to be babies being born, yeah.
So let me right. Well, we'll get to that in a minute. Let me ask you about safe havens. So my understanding is that all 50 states have safe haven laws which allow persons to surrender an infant in a safe location without having to disclose their identity or without being asked any questions. So at your hospital, how often does this happen? Ballpark.
That I know of, not that often. I think about 4 years ago was maybe the last one that I had heard of, where the mom came, delivered the baby, and she did good by just saying, "I'll be back tomorrow for the baby," and never came back. But that's better than leaving a baby in the street or in an unsafe situation.
Right.
So, I'm good. I think safe haven is a good thing, because if you really feel that you can't take care of this baby, then don't put it in a harm's way. Take it to the ER. You can't leave the baby in a parking lot. That's dangerous. They have to put it in the emergency room, because I remember a few years ago in the news, somebody left the baby in the parking lot. No, that person can get prosecuted, because that's not a safe place.
Right.
If she had just gone through the ER door, put the baby down, and left, that would have been perfect.
Wow. God, that's got to be heartbreaking to see that.
But yes. But I think, this person, I think, did the right thing. Yeah. She knew she just said, "I'll be back," and never came back. Yeah. But the baby was safe and very well cared for.
Right. And, no judgment, no questions.
No.
Yeah. So you mentioned the COVID, the birth rate. So one would assume that there was a lot of people staying home through COVID, through the quarantine. And you said there was a study that the birth rate has not gone up, which I thought was interesting.
Yeah, I had read it. I read an article and it said that the birth rate was a little bit down. People, and I was like, not at my institution. Right. I don't think so.
I think. I think after everybody was spending so much time with each other, there wasn't a whole lot of intimacy.
Yes,
people were trying to.
Lot to do.
Right. No, I'm not interested. Right. So I have some fun questions for you. But before we get to those, so what advice, right after 27 years, what advice would you give a first-time pregnant mom about choosing a physician or a midwife to deliver her baby?
Okay. I would say, number one, you have to have, there has to be a connection between you and your provider. Someone that you feel easy, that you can easily talk to them and ask them any question, and that they answer your questions to your satisfaction.
Okay. Good.
I think that they should be accessible to you, return your calls, but someone that you feel comfortable and that you feel this person has answered all my questions to my satisfaction.
Okay.
I think that
Good.
would be, then you know that you and your provider connect and that they're the right match for you.
Right. Particularly if you're first time and you're probably going to have a lot of questions, right?
I was just going to say that in particular when it's your first baby, because you know nothing. I mean, I was an RN and had my first baby, and I can tell you right now, I knew nothing.
Right.
I knew nothing.
Right. It's a whole lot different when it's you, right?
When you're going through it and when it's you. Exactly.
Yeah.
So I had a wonderful, provider. So I think that is the main thing, that someone that you feel answers all your questions to your, satisfaction and is easily accessible to you.
Great answer. So let me inject a little. So besides your son Juan, who's a nurse, and your daughter Christina, and your three grandsons Antonio, Felix, and Manny, are there any deliveries that you hold dear to your heart?
That I hold dear to my heart. For some reason, I remember this one delivery that, and I'll tell you why, because it was just God that somehow in life we kept bumping into each other. And see, I'm fluent in Spanish.
Okay.
And so this patient came to deliver at the institution that I worked at before, and she didn't speak any English, and so I was like able to communicate with her and, appease her anxiety because she was having a baby after something like 10 years, again.
Okay.
And for whatever reason, our paths would cross so many times beyond the years. I would keep bumping into her and her husband, for example, I would go to the market and I would be like, hey, you guys are here. Oh my God. And the baby was, so and so old. And then one time at Lowe's, I'm there shopping and there they are with her. She's 4 years old. Oh my God, look at her. And they're telling her, this is the nurse that helped deliver
that's great.
deliver you. And then one day I was in City Hall doing jury duty, and they were there getting married. And I was like, okay, God.
Wow.
I guess we're supposed to keep bumping into each other.
Wow.
And I haven't bumped into them again, but it was really crazy because I kept bumping into them and they would always say, this is the nurse that helps bring you to the world.
Oh, that's great.
So
that's great.
Yeah.
Oh, that's cool. Very good. Very good. I'm glad you had that experience. That's great.
Yeah.
Okay. All right. Now, two more fun questions. So since we're close to the Christmas holiday and December 25th is considered by Christians to be the day that Jesus was born, what's it like being in the delivery room on Christmas Day? Does it have like a different feel, or is it just like any other day?
I think it always has a different feel, and we try to, this is a Christmas baby,
Okay.
and at the same time, because you have to respect patients' religious denominations, and some people are not Christians and would not, take to that. So you have to, you have to be careful.
Okay.
And you know what I mean, because some people are not Christian. So, but I think it is a special day. We the nurses feel like, oh, this baby's a Christmas baby.
Right.
And sometimes we, some of the nurses will sometimes make little, T-shirts like Santa or little Santa hats, and we put them on the baby. Yeah, for their special day.
Yeah,
So,
and I guess is New Year's too, New Year's Day, like 12:01. Is that?
Too.
Yeah.
Yeah.
Okay.
Yes,
Yeah.
for sure.
Are there any other fun days in the delivery room? Like what? Any dates? I guess maybe Halloween. That'd be a good.
Yeah. Or sometimes St. Patty's Day for some reason, I guess, like I remember we had like green little things for the babies,
Okay. Okay.
So that way. But Christmas and New Year's, in particular New Year's, are the very special ones that we're always like, oh, who was the first baby,
Right. Right. Right.
And
Yeah, I
the
imagine.
Christmas baby, so.
Yeah. But you're right. I
Very
mean,
special.
for Christians or Muslims or, with Jews, it's
Yeah,
not,
you have to be
not
careful.
fun for, right. Yeah, it's okay. You got to meet people where they're at. All right. So last question. So after 38 years as a nurse, I do hope that you're looking forward to retirement. I suspect you will not miss screaming moms in labor, but what will you miss about being a labor and delivery nurse?
I think mainly being a support and an advocate for my patients.
Okay.
Because I speak Spanish, because I am of Latin heritage and I'm fluent in Spanish, I have helped. We have a very large clientele from other countries that I don't know how, and I give it to them. They come here looking for a better life for them, for their families, and don't speak one word of English. And when I see them and I start to talk to them in English and they look puzzled, and then I start to speak in Spanish and say to them, do you speak Spanish? And then they light up like, oh my God, yes, you're my savior, and that is one thing that I'm going to really miss, because I'm going to be like, who's going to be that advocate for them? Because there aren't that many nurses at my institution in my unit that are fluent in Spanish.
Okay.
And, but that's one thing that I think I will miss greatly.
Yeah. And listen, I'm sure they're going to miss you as well. Sounds like because I know that in any hospital there are translators, but it's not as fluent as having somebody right there by your side who can speak the language. Wow.
Right. And so because at my institution and every institution, they have certified translators. I was unable to translate, even though I was fluent, until I became certified. So I took and searched it out for myself. How can I become certified? Translator by this institution. And so they were like, go to the chaplain office. I went to the chaplain office and they gave me these courses that I had to take. Then I had to take a test. And then, I passed the test. So now I'm certified. But I had to do that because they were like, you cannot translate like for a stat C-section. I mean, in the middle of the stat C-section, I'm looking for a phone to find a translator, or the tablet, like when I'm standing there and knows what I'm saying, and they know that I know what I'm saying. But I had to do that extra step and get myself certified so that I could do this and help them.
Good for you, Alicia. No, listen, this is part of why you were a finalist. Really, you are really. I just love, after all these years, you have so much passion, and it's clear that you are dedicated to your patients. So I want to thank you, not only for your commitment to your patients, but just to nursing, right? To training nurses, right? To being a nurse, to, making another nurse your son, making sure that the line continues in your family. And you have had a very successful career, and I am sure that your mom is very proud of you, looking down on you, as is your husband and father. So
that's the only thing I wish they had known to what degree I got to. They know that I got to a BSN, but I wish they could see me, now with my master's degree, and I try to give my students everything. I try to instill the love of nursing that I have into them.
Well, it would you would have to. It would be hard pressed not to feel it from you if I was your student. Really, and I am sure that your parents and your husband know that you have a master's degree, and that you were a Nightingale finalist.
Yes, that in particular, yes.
Yeah. So thank
Thank
you very
you.
much for joining me and for sharing your stories and your wisdom. I really appreciate your time.
No, thank you. I'm very honored that you asked me to come on your podcast.
Yeah, that was great.
I've enjoyed this. Our conversation is like we're old friends.
Yeah,
So
it's great.
thank you.
Okay. Take care and Merry Christmas.
Oh, Merry Christmas to you. May you have a blessed, happy, and healthy one.
You too, kiddo. All right, take care.
Thank you.
Bye-bye.
Bye.
Thank you for joining us this week. We will be taking a short break for the holidays, but we'll be back in mid-January with new topics to explore, new stories to share, and new advice to help you get the best care for you and your loved ones. If you have any questions that you would like us to address in a future episode, please email us at podcast@guardiannurses.com. You can find the Lighting Your Way podcast on Apple, Spotify, Google, Stitcher, YouTube, and guardiannurses.com. If you like what you heard, please tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates at our website, guardiannurses.com. Until next time, we wish you a peaceful, joyful holiday and a purposeful and healthy new year. Take good care.